I want to be very clear about why we're here and what's at stake. The Trump administration is creating a healthcare crisis in Northeast Ohio. Trump's cup to the Affordable Care Act and Medicaid are a 1-2 punch that is going to punish everyday people. This Republican healthcare crisis will mean higher costs, fewer people insured, and more people sick in our community. And today, I am standing with my constituents to fight back. Our message to the White House and to the Republican-controlled Congress is very clear. We need to cancel the cuts, lower the costs, protect health care, and reopen the government. So, what has been their response? No negotiation and no compromise. The House hasn't even taken a vote since September 19th, y'all. Democrats have been on duty while Republicans have been on vacation for over a month now. To me, this is unacceptable. So let me spell out what they are trying to do. Republicans want to end enhanced premium tax credits for Affordable Care Act marketplace plans and enact the largest cuts to Medicaid in the history of the program. That will mean higher costs for people on private insurance, higher burdens for people on Medicaid, and ultimately, thousands of people in Cuyahoga-County losing their health care. A staggering number of people will be impacted and the costs will be real. In Cuyahoga County, more than 50,000 people are on the Affordable Care Act marketplace plans. It's actually closer to 56,000 people. Nearly every one of those folks will see their premiums increase if the tax credits expire. And nationwide, the average price increase will be $700 a year. But for families and older people, the increase will be even more. We ran the numbers for a typical family in my district, a family of 4 in Cleveland, 2 adults in their 40s, 2 kids ages 8 and 10, with a household income of $56,000 a year. Their premiums are going to double. The family of 4 is going to see their premiums jump from $2,400 a year to $4,800 per year. That is money people do not have. And I am incredibly worried about what will happen and the terrible choices that people will have to make. People will have to figure out how to pay rent, pay for insurance, pay the heating bill, and keep food on the table in an economy that is already entirely too expensive. And a lot of people won't be able to do that. To add insult to injury, starting next year, the Trump administration begins the $1 trillion in cuts to Medicaid, along with work requirements. Let me tell you, these work requirements are immoral, unnecessary, and wrong. And they're going to be a huge burden on people. The goal is not to encourage work, because the reality is most people on Medicaid already work. The goal is to tie people up in red tape and kick people off Medicaid, plain and simple. When the Nonpartisan Congressional Budget Office ran the numbers, they estimated that over 17 million people, 17 million Americans, could lose their health care because of this double whammy. In my district, over 43,000 people are at risk of losing their health care. Now, I know I've thrown a lot of numbers at you, but to sum it up, in Cuyahoga County, we're talking about 50,000 people paying more and 43,000 people losing coverage. That is unacceptable to me. And that's why I stand firm, 10 toes down and shoulder to shoulder with the people I represent. The time is now. We need the other side to listen to the people. It's time for them to listen to families, listen to doctors, and listen to local elected officials. It is time for President Trump to work with us to reopen the government, lower health care costs, and cancel these cuts before it's too late. And with that, I want to hand it off to my friend and partner, County Executive Chris Ronayne.
Thank you, Congresswoman Shontel Brown, and thank you for your active work in this district. When the federal government is closed, you are working in our district, and we appreciate it. And I want to say to my colleagues, Council President Blaine Griffin, Councilwoman Deborah Gray, Councilwoman Meredith Turner, we too are working. Our governments don't shut down at a local level, and we need to continue to work for our people. And these are unprecedented times as it relates to our citizens and their vulnerabilities as it relates specifically to health care. We are proud to join you today in this message to our nation to be kind to its people. It wasn't too long ago in this country and in this state that a Democratic president and a Republican governor worked together to extend Medicaid to over 100,000 persons in this county and over 800,000 persons statewide. That was President Barack Obama working with Governor John Kasich. We need to get back to the days when across the aisle people work for the wellness of their people, regardless of party, partisanship. This is about wellness, and this is about all of us. Congresswoman raised the numbers, and when you take the entire Medicaid population, it's an even higher population. Our Medicaid population has been well served in this county for years. Persons who simply need health care to keep their families well and to keep working. In Cuyahoga County, the number of persons on Medicaid number more than 300,000 people, which is more than a quarter of our county. I could get into discussions also about supplemental nutrition assistance programs for our kids and our families, but that's for another press conference. But the health and wellness of our people depends on the basics of health care and food. And if you add up in both cases, Medicaid and SNAP benefits, over 50% of those served by those two important federal programs, over 50% are seniors and kids. We need to keep that safety net strong. Every person, no matter their zip code, income, or background, deserves access to quality, affordable health care. In Cuyahoga County, when our neighbors can't afford to see a doctor, I want to thank the doctors that are here today, the patient advocates, the nonprofits. Thank you, Dana, for this incredible organization, the Village of Healing, for what you do to help people with medical needs, no matter their insurance coverage. But out there, when they can't afford to see a doctor and when parents must choose between paying the rent and paying for a prescription, our entire community suffers. This is absolutely a reckoning moment for our country. No citizen should make a decision between paying rent or transportation or housing costs versus the medical needs that they have. The Affordable Care Act and the Medicaid have been lifelines for thousands of families here. More than 300,000 people, as I referenced, in our county rely on Medicaid. That's approximately 1 in 4 of our county residents. We're talking again about seniors, about children, about veterans, about people living with disabilities. But today, those lifelines are being threatened by our federal government unnecessarily, with cuts to Medicaid and attacks on the Affordable Care Act, and the politicization of that very safety net. These aren't just numbers on a spreadsheet. These are people losing access to health services, to mental health services, to prenatal care, to addiction treatment and preventative care. It will lead to emergency rooms filling up because people have nowhere to go. When we strip away health care, we don't just hurt individuals, we put a strain on our hospitals, we weaken our workforce, and we drive up costs for everyone. It was a day when people saw that across the aisle, that health care was good for the workforce, that it helped our economy, didn't hurt it. It helped our families. We put them on a path forward. But today, our federal government is setting our families back. And when our families get set back, our communities get set back. As I said in our State of the County address last week, we are not sitting on our hands. We are gearing up. I'm glad to be joined also by Kevin Gowan, Department of Job and Family Services today, again, Councilwoman Turner, and our many members of Cuyahoga County that are here gearing up to help families in need. We're fighting to protect access to strengthen our safety net. And there's no greater collaboration than with you, Congresswoman Shontel Brown. Thank you for being a federal leader that gets it and that works while the government is shut down, because you know our communities can't shut down. We'll work together to strengthen our safety net, to expand behavioral health services, and invest in programs that keep people healthy and working. But this work is hard without our traditional partners at the federal government and the state of Ohio, who's also triggered in Medicaid cuts in the future. We need them to hear us. Healthcare should not be a privilege, it is a right. Every time we defend that right, we move closer to a healthy Cuyahoga-County and a healthy state of Ohio and a healthy nation. Our county that lifts people up instead of leaving them behind, that's our goal, working with you. I firmly believe the measure of our compassion is not in what we cut, but what we choose to protect, and we need to protect Medicaid. I want to thank you again and appreciate the advocacy of this group in this room and our citizens all throughout Cuyahoga County who understand that a healthy Cuyahoga County starts with health care. It starts with a safety net that cares about people. We will never give up on that. So this public-private nonprofit partnership that's in front of me today with our elected leadership, with our nonprofits, with our doctors and our patient advocates and our citizens who have each other's back. We are Cuyahoga, and thank you for your advocacy for a healthier Cuyahoga County always.